Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What causes fluid behind the retina? Fluid can build up behind the retina due to different conditions, including macular edema and central serous retinopathy. These conditions may cause symptoms like vision distortion, blind spots, and other vision changes. /r/n/r/n Depending on the cause, fluid behind the retina can resolve on its own or it can become serious. Either way, it needs to be monitored by a healthcare provider. Treatment can help slow or reverse disease progression and prevent permanent vision loss. /r/n/r/n This article lists the conditions that cause fluid behind the retina. It also covers what symptoms to look for and the steps you need to take for appropriate diagnosis and treatment. /r/n/r/n Illustration by Nez Riaz for Verywell Health /r/n/r/n With macular edema, fluid builds up in an area of the retina known as the macula. This is the area that you rely on for sharp central vision. If fluid builds up underneath, the macula can get distorted as the tissue swells. /r/n/r/n Fluid leakage can come from damaged blood vessels nearby in the retina. This can be the result of a number of different conditions. Macular edema can be caused by any disease that damages blood vessels and can even result from eye surgery. /r/n/r/n When you have macular edema, objects may look wavy or distorted and the sizes of objects may vary depending on which eye you're using to view them. Some of the main symptoms of macular edema include /r/n/r/n Treatment for macular edema depends on what's causing it. Diabetic macular edema, for example, can be treated by controlling the underlying cause, diabetes. Some other treatments may include /r/n/r/n Macular edema can be serious if left untreated. The damage to the macula can become irreversible and vision loss could be permanent. /r/n/r/n Fluid behind the retina can sometimes lead to a retinal detachment, pushing the retina away as it collects. This is known as an exudative retinal detachment. If the detachment is not promptly treated and is extensive enough, this can cause permanent vision loss. /r/n/r/n With central serous retinopathy, fluid can build up under the retina. The retinal pigment epithelium, RPE, which is between the choroid and the retina, stops functioning as it should. Without this working right, fluid begins to build up under the retina. /r/n/r/n Central serous retinopathy can cause visual distortion and even a slight retinal detachment in some cases. /r/n/r/n Stress is a major risk factor for central serous retinopathy. People who are often under stress or who have aggressive or competitive personalities tend to be at greater risk for this condition. Other people at greater risk include /r/n/r/n Symptoms of central serous retinopathy may include /r/n/r/n Central serous retinopathy is not always serious and doesn't usually require treatment. Most cases will resolve on their own in a couple of months. However, you do need to be monitored by a healthcare provider since it is possible for the condition to lead to vision loss. When CSR does require treatment, this may include /r/n/r/n Cases of diabetic retinopathy result from the elevated blood sugar that occurs in those who have diabetes. Over time, high amounts of sugar in the blood can damage the retina by affecting the blood vessels. The blood vessels swell, and the tight junctions in them break down, leading to bleeding or leaking fluid. /r/n/r/n Also, glycosylated red blood cells, which have sugar bound to the hemoglobin, do not bring enough oxygenated blood. This triggers the formation of new blood vessels. These, however, are fragile and easily leak and bleed further. This leads to more fluid behind the retina and ultimately may end up in a detachment. /r/n/r/n In the early stages, diabetic retinopathy doesn't usually have symptoms. As the condition progresses, you may notice vision changes that come and go, including /r/n/r/n. Early stage diabetic retinopathy is usually just monitored by your eye healthcare provider. You may need to have your eyes examined every few months to make sure the condition isn't progressing. It is also important to make sure your diabetes is well managed. This can help slow the progression of the disease. /r/n/r/n. In later stages, treatment may include /r/n/r/n. Diabetic retinopathy can be serious if it isn't treated. Untreated diabetic retinopathy can lead to scarring on the back of the eye and bleeding. It can also cause complications such as diabetic macular edema and neovascular glaucoma. /r/n/r/n. The choroid is a layer of spongy blood vessels between the retina and the white part of your eyes, known as the sclera. The role of the choroid is to deliver nutrition and oxygen to the outside portion of the retina. /r/n/r/n. If fluid, choroidal effusion, gets between the choroid and sclera, it can lead to a detachment known as serous choroidal detachment. These are generally related to low intraocular pressure, usually following recent glaucoma surgery. /r/n/r/n. This decrease in pressure allows the fluid to accumulate in the space around the cells while the capillaries become more permeable due to inflammation. /r/n/r/n. Symptoms of choroidal effusions can vary. Sometimes there aren't any symptoms, especially when the effusions are small. Larger effusions may cause /r/n/r/n. Choroidal effusions aren't usually considered serious but do need to be observed and managed if necessary. Effusions that occur after surgery usually resolve on their own. If not, treatment may include /r/n/r/n. To determine if you may have fluid beneath the retina, your eye doctor will thoroughly examine your eyes. Some of the tests they will likely use may include /r/n/r/n. A Namsler grid test is an easy way to determine if your all-important central vision has changed. With this test, you simply look at the grid-like squares and tell the doctor whether any of the lines look wavy or if there are any missing areas. This can help to detect even minor vision changes. /r/n/r/n. Optical coherence tomography takes cross-sectional pictures of your retina with a special camera. It can measure retinal thickness and detect fluid beneath the retina and swelling. With this information, your doctor can determine whether you need treatment for any fluid trapped under the retina. /r/n/r/n. With autofluorescence imaging, the idea is to make use of the retina's naturally occurring fluorescence. Even without injecting any dye, when a blue light is used to illuminate the retina, certain structures glow. /r/n/r/n. These glowing structures can be captured in a black and white image. Characteristic patterns may then indicate that diseases like age-related macular degeneration or central serous retinopathy are progressing and can help indicate appropriate treatment. /r/n/r/n. Fluorescein angiography can be used to diagnose swelling in the retina. With this, a yellow fluorescein dye is injected into your arm. When it reaches your eyes a few seconds later, it will cause them to shine brightly. A special camera can then be used to take pictures of the area. These can alert your doctor about what type of treatment is needed and where. /r/n/r/n. With indocyanine green angiography, the dye works similarly to fluorescein but only can be viewed in infrared light. Also, it circulates deeper into the retinal layers where they can be photographed with an infrared-sensitive camera. This is often used for choroidal angiography to complement fluorescein angiography of the retina. /r/n/r/n. With this test, also known as a B-scan ultrasound, sound waves are used to create a picture of structures within the eye. This technique can be used to detect complications such as retinal detachment, diabetic retinopathy, and eye cancers. /r/n/r/n. Fluid beneath the retina can occur due to inflammation or leaking blood vessels in conditions such as diabetic retinopathy, macular edema, central serous retinopathy, and choroidal effusion. An eye doctor will perform an eye exam and may use various imaging methods to assess the problem. /r/n/r/n treatment depends on the condition causing the fluid buildup. Anti-inflammatory medications, surgery, laser treatment, anti-VEGF injections, or lifestyle changes may be used. /r/n/r/n/r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.